Representing California's 5th Senatorial District, Susan Talamentes Eggman has a long career in public service, from serving in the U.S. Army to becoming the City of Stockton's first Latina council member and in her 11th year in the legislature. Senator Eggman has built a reputation on taking on tough issues and seeing them through. Senator Eggman joins us today to share her story and her views on the issues facing California. Senator, with such a varied career, ranging from agriculture to academia, how is it that you define yourself?
Oh, what? That's a hard question when we start but I
we
guess
were told that you've got broad shoulders and can handle it.
my 12-year-old calls me, my superhero name is the Handler. Don't worry, Mama can handle it. So that's my superhero name, is the Handler. I guess one thing to just describe me is that I just hope people think that I'm a good person and did my part to keep this world spinning on its axis. Although I will say, as a hospice social worker, I spend a lot of time with people dying, and I've done a lot of work in that space. So I think a lot about obituaries and what's on tombstones. And despite whatever else I've done, I always say I wanted my tombstone, she could cook.
Yes, and we're going to come back to that because we hear you're famous for your sourdough bread. But I want to take you back to the beginning. And you come from an agricultural family. And I'm curious, what experiences from your early years with your family on that almond orchard do you draw on or come to mind for you as you're making policy or you're fighting for the interests of your constituents?
You know, I think as many of us get older, we feel like we are becoming our parents, and I certainly wish mine were still living, so I could have conversations with them in my adult self. My family has an interesting history. Just in my dad's family came from kind of a grapes of wrath story up out of the South, and my mom's family came from Mexico. And so they married in the 50s, both of them with a very limited education and high degrees of poverty, but just with the real, they got married in the early 50s, and a real time, I think, of hope, of if you worked hard, that you could make anything happen. And this idea that my dad was a man who didn't really read or write, but he loved agriculture. He loved animals. He was, like he could, we got roses in someone who got roses, my dad could make them plant and grow. So I guess it's just a real, what I got from that time on the farm was kind of, you get out of life what you put into it, right? Literally in agriculture, right? What you put into it is what is going to come back, and that we're all responsible for each other, and that hard work, an honest handshake, and caring about other people are kind of what defines life and family.
You talk about that your father came from kind of a grapes of wrath story from, I assume, another part of the country out here looking for opportunity. He's passed on, as your mother, but if they could see you today, what would they think about the journey you've made?
That'll make me cry. So my dad, God rest his soul, lived long enough. He died my first year in the assembly, and he was so proud that I was, at that time I was chairing the agriculture committee. So he was very, very proud of that. So they would be. He would make everyone call me a senator. He had trouble with words sometimes, so he would make a joke about it. My mom would just be beside herself. My mom, when she loved, so my grandparents became citizens so they could vote for JFK. So politics were really important in my family, not as a not, people weren't active or running for office. That would have been just so tremendous for my mom, but she loved politics. She when she was dying, I'm like, Mom, what was the best part of your life? I'll never forget. She said, oh, honey, those Watergate trials. It just felt like I was right there, but she was glued. So I just grew up very much with understanding that government was there for us and for the people in public education and public libraries and all of that kind of that public good that goes forward, that their daughter could be a part of that. I think it would just be they would be incredibly proud, and I carry that with me every day, and it certainly makes me, when I walk into this building, look up and think, I mean, only in America could something like this happen. And I guess just the huge responsibility I feel to use my time as wisely as possible.
Right. Tell us about your family today.
Okay, so my family today, as I define it, but so I in the military, I met my partner and then became my wife, Renee, 39 years. So we've been together 39 years.
Congratulations.
Thank you very much. It wasn't legal to marry until later, and so we had our, I think, 7th year officially married, and before that we were domestic partners. And then so I ran for Stockton City Council. And I should say, my mom was just so proud that I got a PhD and now as a professor, right? That was, I mean, she was very, very excited about that. And I didn't run for office for my first time until she had passed away in the year I finished my doctoral dissertation. She passed away in 2002. And I ran for office in 2000. I served my first term in 2006. Anyway, so she wasn't there for that, but she would have been so proud. But I was also her caregiver, so I couldn't have run while she was alive. So it was funny. But anyway, my wife's sister, my very first year in the legislature, developed. It was this time of year actually, because we were voting on the budget. 2013, I was in the office with Nancy Skinner, and my wife texted me and said, my sister texted me and said she wants me to take her to the hospital. She thinks she's dying. I told her she's crazy. She's kind of a hypochondriac. You don't have health care insurance. Anyway, she took her to the emergency room, and in fact, she was dying with a very aggressive form of cancer, and she died August 11th, 2 months later. And the next day, her beautiful little almost 5-year-old girl moved in with us, and we have since formally adopted her. So I have a wife. I have a 12-year-old, almost 13-year-old daughter. We have 2 dogs, 2 cats, and 2 chickens. A house all of girls.
Okay. When you look at, you referenced the fact that before you were able to get married, you were in a domestic partnership. And we know that you've been very active in the leadership of the LGBTQ caucus. When you look at the span of change that's happened just over your own career, what is the next big frontier in the fight for equality and civil rights?
I would say that the transgender issue. I think that is the next horizon. We had our LGBT caucus meeting this morning, in fact, and that's what we were talking about, looking at seats that are coming open across the state that we think are viable for the caucus, and that is one. We don't have a transgender person yet serving in the state of California in the legislature, so we'd like to see about doing that. And I also just think it is as people are coming out from the pandemic, right? It feels like everybody's coming out. There has just been more and more. I think 2016 really motivated people to get involved more in their process. So a lot of younger city council members in smaller towns where they used to be pretty conservative dominated, older, Caucasian demographic, a lot of young people of color, and now they're trying to raise flags. So there was just a big issue in Kingsburg. A young city council member, first Latina, she's bi, she wanted to raise the pride flag, and they had like 4 hours of public debate where people came in on buses and said that's terrible, we're never going to do that. And then in Fresno, there was just a kind of an issue where they raised a flag, in Gilroy. So it is also, I think, just the normalizing of the LGBT process across the state, right? You don't have to go to San Francisco or a big city in order to be who you are. This last weekend, I went out to my kind of first post-pandemic thing, and it was a gay pride event in Lodi. Lodi's very first time, and it was so great to see so many, and I don't even know how people identify, but young, like preteens, and they were just, people were having a great time wearing rainbow wigs, and it just, I saw another friend who she just turned 70, and she is not, she's an ally, she's not an LGBT person, but she said, this is the most normal I have felt in a year, and it's gay. I'm like, well, great, we're here for everybody.
So, you know, that raises a really interesting point. When you look at your district, it's this unique combination of urban and rural. And was it challenging as a member of the LGBTQ world, you know, and because of your orientation, was it difficult in order to kind of scale that height in the beginning? Not just because in the city of Stockton, where you're a council member, it was more urban environment. But a lot of us have assumptions that the rural environments are a bit more challenging.
I don't think that's false, but I'll go back to the first question you asked me about who, you know, who am I? And part of it is that agricultural background. Like I am an LGBT person. I'm a person of color, but I also grew up on a farm, right? I'm a farmer's daughter. And so my ability, I think, to be able to talk to people and let people know that I'm working for them. To me, that has been the biggest issue. It is not how I identify. It is what I am, how I am able to serve. And I think that's what resonates mostly with people.
Isn't that the way it's supposed to be?
That's the way it's supposed to be, right? When I first was going to run, and people like, just, you cannot run as an out person. I'm like, I'm not going to hide. I'm certainly not going to lie. I'm going to deny the person that I love. And then if I can't be honest and fight for myself, why would you think I could fight for you or be honest with you? So I was out from the beginning, and it was an issue in the beginning. The reporter, Dave Siders, is now a Politico, a great reporter, but he did this whole thing where he followed me around as I was precinct walking, and then went back and knocked on their doors and said, do you care? Do you care if she's gay? And the people didn't care that much. And it worked. And from then, I think, then just being in relationship with people, showing up for people, it's my district. It is surprising, but it is the most heavily Trump area that a Democrat represents in the state of California.
Well, that's really interesting, because as I looked at your statistics, every year that you have run, your share of the vote has gone up, if I'm not mistaken.
You are not
And
mistaken.
so that kind of proves your thesis.
Yeah.
That kind of proves your thesis that being in relationship with people and having exposure really does break down walls. How do you take that and use that to address some of the bigger issues that we're facing as California?
In conversations, in stories, just the same thing we're doing right now. I passed the End of Life Options Act here in California, right, which was a very big deal, death with dignity, and that took just so many conversations, and being prepared to sit and listen to people and listen to people's pain, and even if there are tears, to be able to really engage with the issues. Then there's other bills I've done, like safe injection sites, overdose prevention, issues that aren't necessarily carried by somebody in the Valley. But at the same time, I am a champion on the Delta issues, on water issues. I have been a champion on doing ag in a more smart way, understanding that we're a community in transition. And so how do we do it, not just cross our arms and say, no, we're not going to make changes, but how do we do it in a way that brings people in?
You have a reputation of taking on really tough issues, and that, no offense, but you are a workhorse much more than a show horse, and that you're going to roll up your sleeves. Let's just take one of those issues, which is the End of Life Options Act. That is one where for decades has been hotly debated. What made you, representing an agricultural urban community, what made you step in to something that not only was so complicated, but inspired such fierce emotions on both sides?
I mean, it just goes right back to that, to whom much is given, much is expected. I think it's an incredibly important policy issue. Like I said, I was a hospice social worker. I sat by so many people as they died. I have personally cared for multiple people in my own life. I've done research on the topic. So I felt it was important, and I felt like I could do it, right? I brought both my personal experience, my academic experience, my professional experience. And I just, I don't mean to say that in an egotistical way, but that package at that moment, and it was the time that Brittany Menard had gone to Oregon to utilize the End of Life Option Act there. And so there was, for everything there is a season. And I didn't, it was my goal to do that bill. I thought maybe in 2022 I would do that bill. I didn't think we would be doing it in 2015. But politics, again, it's like farming, right? When there is an opportunity, when the sun is shining, when the conditions are going to be right, that's when you have to go. And I was in a position to be able to do it.
When you think about people that were on the other side of the issue, a lot of their sensibilities are informed. If you talk about medicine, the Hippocratic Oath. If you talk about, for some, and there is a divide within the faith community, life, is sacred, and we should not be in the business of helping people end life. Just give us just a small example of how you negotiated having those conversations, not necessarily to change minds, but to get people to understand where it is that you and the supporters were coming from.
I think one is through listening, so you're able to tell a story. One of the stories I told in my close, and it was a woman who, I mean, it was a very passionate issue. I'm going to be on a panel about it today, but she came and her health declined. We could see her health declining every time she came to testify. And she was a woman who was, and she said, I'm a Republican. She was a law enforcement. She was a detective in the Los Angeles Police Department. She became a district attorney. She was a single mom, and she, had her daughter, raised her through law school. She said she would sit under her desk when she was, going to college. And it was her wish, and she had a terrible, 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 terrible cancer. And she had tried, she had fought, she had done everything. So she said, I've done everything to live, but don't tell me how I'm going to die after I have done everything to live. And she wanted her gift as a mother for her 21-year-old daughter to be able to remember her the way her mother wanted her to remember, not to remember her in the last throes of what she knew was going to be a very painful and a drowning kind of death. And she wanted to be able, she's like, I've taken care of my daughter her whole life. Why wouldn't I want to protect her here at the end? And so I think stories like that, when you can appeal to somebody as a parent, thinking about their own end of life, those stories, I think, move people. And the idea of just sitting, because most people who have a strong aversion, they're looking at somebody else's death, somebody's death they loved, a fear for their own death. So we're very much a death-defying culture, right? We don't want to think about it. I talked to someone the other day. I mean, the manifest destiny, right? I mean, we think we can build bridges. We think we can live forever. We'll go to the moon, right? This idea of death being so final terrifies a lot of us. But we're all going to die, right? Well, none of us are getting out of this alive. And again, for some, they want to be able to chart their own path, right? And the majority of people who use it, the fear tactic is it's going to be you're going to kill off poor people or people of color. But for the most part, it is a demographic of folks who have been used to being in charge of their lives all their life, and they want to be in charge up until the end. And again, these are terminally ill people from which no cure is expected.
Right. Let me pivot from that issue and go to another one that says just about as intractable. You have been against the tunnels, the tunnel project, and the Delta and its environmental integrity and its future is something that confuses so much of us. With so many great minds at all levels of government and in the private sector. Why can't California get its act together on coming up with a reasonable solution on this?
You know, you're right. It feels like the high-speed rail, right? It feels like something that we all agree, like in theory, we understand how it's going to work, but it's the implementation and actually getting it done. That's the very difficult part. California, somebody was asking me about mental health the other day and why are things that much worse now? And if we just, I mean, just think about this for a moment when we talk about water and it should be simple. In 1975, and we can talk about mental health from this perspective too. When we started deinstitutionalization and we really started, Jerry Brown was going to come into office for his first time and think about these tunnels. There were like 22 million people in California. 2021, there are 40 million people in California. So we have just exploded in our population growth. And that water system was not made for as many people as we have now. Right? It just was not. And I think kind of like death, we thought we could farm anywhere if we could engineer it in the right kind of way, right? We'd just put those tunnels down and take this water. So a lot of I think the premise that we can farm wherever we want and the water is just going to come for as many people, I think that is just flawed. So as much as people don't want to have to think about fallowing land, we know that is going to happen because we have so overdrafted our underground water basin. So it is, we'll get there. I do believe we'll get there, and we'll find a solution that's going to work for everybody. But I think we had to get away from yes tunnels, no tunnels to something more in the middle, which I think this administration is moving in that direction.
I'm curious, you have taken on these very heavy issues, complicated multi-year and all that. Who inspired you in your early years as a role model with regards to how it is that you were going to go about doing public service?
I don't know that I had any huge, I mean, just my parents and my family and I think I have the ability, and I think most of us do, if we just kind of tap into it, to take what we learn in one situation and apply it to another, right? And that's, I think, what I've learned just in coming from a farming family and kind of a scrappy family, is you can make it work. You just have to, like I talked before, like the end of life, you had to see the opportunity, you had to see the opening, you had to see kind of how things are going to line up, and then make that move. My dad,
Is that type of optimism something you share on the other big issue that's really under debate right now, particularly with the recall, which is that there are a number of people, and increasingly on both sides, who think California is virtually ungovernable and we don't have the ability to face our big problems. How would you respond to those folks?
I say I live in a world of abundance, and I wish we all did. There is enough for all of us. I think when we start living in a world of scarcity, when we think that only some of us can get enough and others, like justice is not a pie, right? Just because you get a bigger piece doesn't mean I get a smaller piece. There's enough for all of us, and so I certainly believe California, our economy. I mean, people say, well, our economy, everyone's leaving. The numbers report just came out. Our economy is stronger than Texas, stronger than Florida, stronger than all those places that folks say people are leaving to. On the wildfire issues, climate change is real, right? And I think on the issues of our forest, again, like the issues of our mental health system, I think there was a time when we locked people up because we didn't like the way they looked or who they loved. There was a time when we cut old growth forest. We figured out both of those things were wrong, but I think those pendulums swung so far to the other side that we didn't take care of our forest, and we have wildfires in the forest, and we have wildfires on our streets of people in crisis.
If you were charting, well, that being said, if you were charting the agenda for your colleagues and for the administration over the next 2 to 4 years, what are the big pendulums, 2 or 3, that you think really need to swing in the other direction in order to give everybody in California a better life and a better set of opportunities?
I think Homelessness, especially as it relates to mental health issues, we have to be able to solve that. The amount of people that we see on the streets in really crisis states is unacceptable. So I think homelessness, I think mental health and how we deal with it and how we are, and I'm very, very, very excited that as the chairperson of the budget on Health and Human Services, that we are making historic investments in the mental health system. So I think we need to really focus on that. And then the other thing, we need to be able to build more housing, and we need to develop a plan for our climate that makes us resilient. So that's for wildfires, that's for sea level rise, that's for our levees, that's for how we farm.
I'm curious, with all the fights that you've led and you've participated in, what has been your proudest moment in terms of your work as a policymaker at the state level?
Oh, if I just have one. But so you think about things that leave somewhat of a legacy. And for me, it's about people's lives, right? I did like a $1 billion solar bill for low income housing. I'll always like that, but there are two challenge academies in the state of California. It is a intervention program for kids who have either dropped out or at risk of dropping out of high school. They are run with the National Guard, one of the both best evidence-based turn your life around programs, 6 months inpatient and then 6 months aftercare. Anyway, we got a third one in the state of California started in my district. And so they have now around like their 8th graduation class. And I just went and spoke at their graduation. So, I mean, that's thousands of kids who have had a second chance to turn their life around and go back to their families. Those the kinds of things that you can visibly see you've made an impact on somebody's life.
That's wonderful. And I think we'll leave it there.
Okay.
Thank you for joining us, Senator.
Thank you.
And good luck in your work.
Thank you very much.
And that's our show. Thanks to our guests, and thanks to you for watching Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE. All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.